Okay, so my topic that I chose was MRSA. So the scientific name is methicillin-resistant Staphylococcus aureus. It's a type of deadly bacteria that is resistant to most antibiotics. From the picture on the right here, you can see this is what a MRSA infection typically will look like. The bacteria can stay on surfaces for up to weeks and it can infect people with open wounds. This will typically happen in people with a weakened immune system generally because they are more susceptible to viral and bacterial infections. There are normal staph infections that only require antibiotics, and those will just kill the disease causing bacteria, prevent them from going. However, MRSA is not one of those bacteria that are easily eliminated by antibiotics, which makes this way more deadly. So, the effects of MRSA skin infections are the most common, as you can see on the picture to the right here. In the infected area, there's the pus, the white blood cells, and then it appears to be like the gram positive cocci bacteria that's growing, and the skin is inflamed and elevated. And then you have other effects like pneumonia, which is more severe. That's the inflammation of air sacs in one or both lungs. And then sepsis, which is your body's extreme response to infections. So, depending on how severe this infection is, you can have fever, chills, nausea and vomiting, diarrhea, fatigue, severe pain, etc. And then, obviously, the most severe effect would be death. There have been more than 35,000 people die from MRSA, and every year about 3 million people in the US are infected with an antibiotic resistant bacteria. So, how MRSA is spread? Skin to skin contact is the most likely way. There's colonization, which is people who they carry the MRSA, but they have no symptoms. So, they might not know that they have it and they can spread it to others who are vulnerable to this bacteria. The image on the right will show the more common colonization sites like your neck, your forearm, your hand, your ankles, etc. Wound contamination is definitely another possibility because of the bacteria, and then obviously sharing items that have touched infected skin. So, symptoms of MRSA include redness, swelling, pain in the affected area. The affected area will be warm to the touch as well. You can get a fever. The infection will most likely be pus filled. It is often confused with a spider bite because they do look very similar, and it can manifest as a pimple or a boil, and then a rash will most likely occur as well. So, common places that MRSA can be found. So, desks and chairs, gym equipment, especially because people tend to not wipe down their equipment before having somebody else use it. And that's, a very common way for bacteria to be transferred from one person to another. And then, like lockers, faucets, light switches, remote controls, hands, just very general things that many people could have touched are ways that MRSA can be found and transferred. So how MRSA happens, this is more the scientific approach to it. So when an isolate produces an altered penicillin binding protein, PBP2A, the staphylococcal resistance to oxacillin and methicillin will occur, and the most common gene found in bacterial cells that mediate oxacillin resistance in staphylococci is the MECA gene. So, as you can see on the right here, this is a typical PCR test, and that is usually how MRSA would be detected. So this is an SEM, otherwise known as a scanning electron micrograph of gram-positive cocci of MRSA. So we have Staphylococcus aureus bacteria on our skin. That's very normal. However, the antibiotic resistant version, which is the MRSA. That's the deadly bacteria you do not want because there are multiple antibiotics such as the methicillin, oxacillin, penicillin, and amoxicillin, which are the typical medications used in treating an infection. These won't work. So that's why the MRSA is much more dangerous to have. So MRSA screening, that is usually how the MRSA infection is detected and how to see if the treatment for it is actually working. There are minimal risks. It usually will take about 24 to 48 hours for enough bacteria to grow to show up positive on a test. And then there is a new nasal swab test called the Cobas Vivo DX MRSA test. And that can usually detect MRSA in about 5 hours, which, the faster you detect it, the better your chances of having a full recovery. So, if that's a possibility, if you feel like you have the infection and you want to get tested, hopefully you're able to. And there are more serious cases that will need an IV with powerful antibiotics that will hopefully treat the infection, but this is not a guarantee. So the ways to test for MRSA, there's a wound sample, which a swab is used directly on the wound to collect the sample and test it. The nasal swab, which if you've ever gotten a standard like COVID test, they put the swab inside your nostril, twirl it around in there, and that's how they use that to test. And then you have your standard blood test and your urine test as well. So these are case statistics that I found in Denmark. They're the only place that I could find consistent statistics. I'm not 100% sure why, because as I mentioned before, there are 3 million people in the US that are infected every year. So you can see from about 2001 to 2009, 2010, the number of MR cases are pretty low, and then it starts to go up from there. And then I have on the left here the past 4 years of these statistics where the cases have been over 3,500. So in 2019, that would mean 82% of the cases were in Denmark alone, and then 18% were worldwide. And then this typically happens, it's more common in Denmark because there is a CC398 MRSA type, which is closely associated with live pigs. And 86% of cases were found with people who have had direct contact. So this type of MRSA is more common in Denmark for that reason. So lastly, this is just a table I wanted to include because most of us are going into the medical field or already work at a hospital or a nursing home or that type. So it's just something to kind of think about in the past 6 months. Um, Contact for hospital and nursing home would be 203 people. Um, there were 23 outbreaks from hospitals and nursing homes, and of those 23, 7 occurred in a neonatal department. So I know these statistics are mainly from Denmark. However, it's still a very important infection to know about. I have actually had MRSA back when I was about 15, and they made me stay home. The doctors made me stay home from school for a couple of days. I couldn't walk on my leg. Um, and I had to find out on my 16th birthday if I was able to just treat it normally. And it was definitely very scary because I had no idea what it was. So it's just something to be aware of, that all types of bacterial infections can happen, but this is one to be worried about. So yeah, these are the references, and that's basically it. So thank you.